Okay. Good morning or afternoon, everyone, depending on where you are in the world. My name is Matt Vallière. I'm the Executive Director of the Patients' Rights Action Fund. For the benefit of some of our friends with disabilities, I'm an early 40s man of color with black wavy hair, black trim beard, olive complexion, wearing a purple check button-down shirt and a blue blazer. And behind me is a knotty pine wood background. We have some very interesting speakers for you today. The title of this webinar is called Global Perspectives on Assisted Suicide and Euthanasia. We wanted to bring together a group of people from various countries, allies of ours who are fighting against these insidious public policies, but to give our usual audience a kind of a more global perspective. To understand what's going on in other places and what our allies there have to face, and how we can learn from one another and collaborate with one another. So first we have Reid Davenport. He's an American documentary filmmaker and director whose documentaries I Didn't See You There and more recently Life After are Sundance award-winning films. Life After shows in stark relief that in a society where ableism and poor healthcare can limit options, assisted suicide laws cannot represent choice when seen as the only option. Laurent Frémont is the public relations director of the Société Française d'Accompagnement de Soins Palliatifs, which is the French Palliative Care Association of Medical Professionals. Krista Carr is the CEO of Inclusion Canada, a national organization that advocates for the full inclusion and human rights of people with intellectual disability and their families. They're collaborating with other progressive disability rights organizations in a charter challenge in American speak, that's a lawsuit that would, if successful, overturn Track 2 of Canada's euthanasia law. And finally, the inimitable Liz Carr, famous British actress and international disability rights advocate who with the BBC last year released the documentary Better Off Dead. Liz is also a member of Not Dead Yet UK. And of course, we have our ASL interpreter, and behind the scenes, we have live captioning. So a little bit of housekeeping. This will be a conversational webinar, so we'll take questions via the Q&A function throughout the conversation. So if you move your cursor around, you can see that there's a little bubble box with a question mark in it that says Q&A. If you click that, you'll be able to type your questions. Please type the question, your name, and organizational affiliation if you have one. If you're from the press, please advise which outlet. And for any further media requests, please contact Bill Pierce at WPIERCE at apcoworldwide.com. That's APCO worldwide.com. The session will be recorded and we'll share a link on our platforms afterwards. Panel and hosts, for anyone who's not speaking, please do keep your mic on mute. And if you can benefit from closed captions, to turn them on, there's also, move your cursor around a little bit and you'll see the toolbar at the bottom. There's a little bubble that says CC on the inside of it. It says show captions. If you push the little caret in the upper right corner of that, it will allow you caption settings, and you just turn them on from there and you can adjust the size of the captions from there. Okay, so I'm just going to start off with a question for Krista, who's our northern neighbor. Krista, could you just give us an understanding of Track 2 in Canada? I mean, for those of us in other countries who are facing assisted suicide proposals, obviously in Canada, it's been legalized. But what we don't often see in other countries, and certainly not in the American states that have legalized, is this Track 2. And so if you could help us understand what that really means in real time and what its impact has been on the disability community, I think that would be really helpful to see both the kind of why Canada feels like it's got completely off the rails on this issue, and it's just at the bleeding edge of the euthanasia push.
Yeah, thanks, Matt. Really happy to be here. Not so proud of the topic that we're having a conversation about. But in Canada, um, we had a Supreme Court case a few years ago, which dictated that there had to be some access to assisted suicide in Canada, euthanasia, in certain circumstances. The court did not define all of that. And we initially legislated medical assistance in dying, euthanasia, to be targeted to end of life. So anybody terminally ill, suffering intolerably, wanting to control the timing of their death, became eligible for assisted suicide. When track two, so we now call that track one. At the time, we just called it assisted suicide. The track two that was announced is was brought in a few years ago, 2 or 3 years ago, for only for people with disabilities who are not at end of life. So it is a special track that is you become eligible for if you have a disability, are suffering intolerably, which we know is very often caused by all kinds of extraneous factors and not caused by disability at all. And this group, and only this group, has the right to end their lives by lethal injection when they are not otherwise dying. So the impact has been tremendous. It was a move that disability rights organizations across the country of people with disabilities, families, opposed vehemently. But we were kept being told, but this was what the general public supported. And it's interesting because since when do you make public policy about the people that are never going to be affected by it? And so hence what has ended up happening is people with disabilities who are living in poverty, lack of supports. We know all the stats around disability. I'm sure they're not different in Canada than they are anywhere else in the world. Have been significantly impacted by track two made, either by feeling coerced by ableism in the medical profession into taking track two when they show up in the healthcare system for regular, ordinary, everyday health issues, and or having lives that are very, very difficult, not because of their disability, but because of the supports they have been denied, or the poverty they're living in, or their lack of opportunity, and the social stigma, etc., and feeling like maybe death would be better than having to live that way. And
Yeah.
so it's been horrible.
Reid, that kind of brings me to your documentary Life After, and kind of maybe you could give us an understanding from your research and everything that you did with the documentary, why you decided to do this documentary now. Because I think that the documentary really speaks to that last point of Krista's.
Yeah, thank you. Thanks, Matt, and thank you for having me here. I'm Reid. I'm a white man with glasses and curly hair wearing a purple plaid shirt. Um, yeah, so the film actually started out somewhere a little bit differently. I followed this story from the 1980s of Elizabeth Bouvet, who was a woman with cerebral palsy who shot the right to kill herself in California. And, uh, and after years of trials, she kind of disappeared. So my film was about trying to find Elizabeth, and I had known about Elizabeth for years, and I would come across contemporary stories that really echoed the questions that Elizabeth's story was raising. None the least, um, what was happening in Canada with me with track two and how we argue that similar to how Elizabeth didn't have the options to life that non-disabled people had, we'll see in Canada, like Krista alluded to, a lot of disabled people who are impoverished and isolated, seeking death, not because of their little disabilities, but because of their social attitudes towards their disabilities.
Right. Yeah, and I think that that's some of what we also face here in the US. It's not as though there's something similar to track two in the law, but because people with disabilities face a kind of social stigma, there's this latent ableism under the surface where people with disabilities are not seen as that their lives are not as worth living as others. I mean, over 80% of American doctors polled in a Harvard study so that they don't think that life with a disability is as worth living as one without. When you're faced with that, uh, that is the exact sort of thing that says, okay, well, for everybody that expresses a desire to kill themselves, we get suicide prevention, except for those people. Their suicides are rational. And that's a very dangerous way of considering a kind of general population in a public policy. In particular, we have seen so many people with disabilities who, because of their disability, end up falling within the letter of the American statutes, the 6 month or less prognosis, where they can opt to forego care in order to qualify for lethal drugs, which makes this supposed 6 month or less safeguard just totally circumventable and arbitrary. And in the end, if somebody wants this thing, would like to have their death hastened, we effectively would have track two here as well. And that's what we're fighting is something that's bigger than even assisted suicide laws. It's the idea that some people have less or more human dignity than another. That's kind of at the root of some of this. Liz, could you tell us a little bit about what's going on in the UK? We keep hearing in some of the American media outlets, the UK passed assisted suicide, and I know that's not true. So maybe you could give us a little bit of the actual situation on the ground and what prompted your own documentary, Better Off Dead, question mark.
As I'm wearing the merch on my shoulder, absolutely. But let me talk really briefly about what's happening in the UK. The terminally ill adults end of life bill is making its way through our parliament. It's a parliament with two stages, like in many countries. I think it depends. If you support these laws, then you're probably going to say it's gone through. And it hasn't gone anywhere near that. But what happened is that there was a vote at the end of November, and the line was, if we don't pass it now, we don't get to debate it at the next stage. So if you'd passed, let's pass this law, let's vote it further, then we get to go to committee and have reports and evidence. And so that's what happened, is that a lot of MPs, bear in mind, there's, we all have our different, where our countries are at politically. Let's not go into that at the moment. But in the UK, for example, we had a new Labour government. So a lot of this is also lined up with who's in power, in who they're trying to please. And it's a political ball in a game as well. So that's going on. Let's not forget that in all the countries that we're talking about. Anyway, it became, it was voted on. So it's gone through to the next phase. And in the meantime, there is a committee. But interestingly, the committee who discuss the bill are led by the person that proposed it. And of course, the person that proposed it, Kim Leadbeater MP, is incredibly pro assisted suicide. And she could also decide who was going to be on the committee. So, and she could also decide who could give evidence at the committee. So whilst we were told,
So you're saying it's a rigged deck.
it's slightly, I mean, she's, she tries to come across as very fair and say actually no anti-people or no concerned people had to be on that committee, which is devastating. But that would have lost it all credibility. So it does, but it's something like 14 to 8 or 9. So 14 supporters versus 8 or 9 MPs who are against. So whenever an amendment or something is brought up, it almost never wins, never goes through. And these amendments will be about making it safer. The law it will come back in about the end of April, probably mid-May, to be voted on again. Then it has to go through our second house, the Lords. So it is not yet anywhere near. And we are working really, really hard to make sure that it doesn't win at that next vote.
Right.
I made a documentary, much like Reid, I'm sure, as a disabled woman. I have very deep concerns and understand, I think, that this really is about society's view of illness, aging, disability. That's at its basic. That's what this is. And my belief is that as long as we have inequality and that some people are viewed as less valuable than others, we can never have a safeguard that will keep people safe. To explain that, which is really hard to do, when everybody thinks assisted suicide, not everybody, but you know what I'm saying, it's about choice and autonomy and it must be a good thing. Took me 58 minutes in a BBC documentary, and that took me 11 years to get made. Sorry to talk about made, a very difficult law.
Yeah, we don't use that. We don't use that silly euphemism around here.
I know. So yes, the documentary, I just want to say it's on YouTube, it's on iPlayer if you can get BBC, but it also now has an international license. So I just leave that there. It can be shown now all over the world, and that's great. It's a useful resource and talking point, I think.
That's fantastic. Thank you. I do want to ask kind of a general question to all of you. Obviously, terminology matters in this conversation. Our side often will say, no, this is assisted suicide, physician-assisted suicide. And we would call when the doctor does the direct killing as opposed to writing a prescription, the patient kills themselves, we would call that euthanasia. But the other side likes to come up with all these euphemistic terms. Things like the one that used to be in vogue was death with dignity. And now we're looking at something that's kind of, I think, sprung out of the Canadian situation, is medical aid in dying. And they're now even using that here in the US, even though what's practiced in Canada is euthanasia for the most part. People are naming what's going on here, which is really restricted to assisted suicide. At least that's the idea. I'm not sure that the letter of the law actually does, in fact, restrict. But what do you all think about what the terms are and why they're so important to this conversation?
I can jump in. I can start. I'm sure everybody has an opinion about this. It's a sanitized version of the language. It's in Canada, they now call it a medically effective treatment option. Well, it's about the most effective one you're going to get, a 100% effectiveness 100% of the time. So it really is language that I think is used mostly to make the general public feel more comfortable with the idea of what's this is just another treatment that the medical profession offers to people. And so one of the things that we really have to work hard at, because MAID, medical assistance in dying, has become such a buzzword in Canada, it's to constantly be trying to call it what it is. And I love to remind people that it is an exemption to the crime of murder under the Canadian Criminal Code, which people kind of like to, they sort of go like this too, but I mean, it is what it is.
Thanks, Krista. I think that's helpful context. And I guess I would say, for whenever we're talking to advocates here in the US, and certainly in our own communications, we just never use these euphemisms ever. We might deign to say assisted dying as opposed to assisted suicide if we are certain that some journalist will not accept the quote otherwise. Outside of that, I'm just not going to go to medical aid and dying. I didn't even hear about this new euphemistic term, medically effective treatment. Yeah, it's interesting.
I think if you, Matt, what you're saying as well, and Krista, it's like if you control the language, you control the argument. And I think certain words are really frightening. The word suicide, people don't like that. I understand why. Euthanasia. And I don't have the quote now and the stats, but it's if you have, when you start to use those words, it gets less support. So once you start to use words like assisted dying and MAID even, it all sounds very fine, and dignity in dying, who can say no to that? Whereas suicide and euthanasia, they have histories, they're uncomfortable words. So in the UK, for example, the Voluntary Euthanasia Society became Dignity in Dying. It's about PR and it's about spin and it's about acceptability. So currently in the UK, the committee debating this issue, the loaded committee that I referred to, get very angry when those who oppose use the word suicide, and they say people are dying, so it's not suicide. There is a difference, they say, in wanting to die when you're terminally ill and at the end of your life to wanting to die and end your life. I mean, you will get doctors, you will get palliative care experts. I looked at you, Laurent, and and it's so many experts and psychologists and psychiatrists who go, that is not true. When people are dying, they do get depressed and they do get, they have huge anxiety that needs to be worked through as well.
What seems,
language.
Yeah, what seems so wild about that is that, in fact, whether it's in jurisdictions like some of the US states or as proposed in the UK, this is supposedly supposed to be limited to people who are actually dying, which is obviously not the case, given the many people who access this thing that are not, in fact, dying. But that same terminology is used in places like Canada. In fact, that's where it came from, to say medical aid in dying or something like this. Is just it's a red herring. So I wanted to turn to Laurent. I think for those of us in English speaking countries, we don't read the French newspapers, and it's a little bit of a mystery, to be honest, what exactly is happening, because you hear from time to time there'll be this little blip somewhere in the American or the UK media that says, the French Parliament is debating an assisted suicide proposal, or the president has put together a group of citizens to discuss this. This is a couple of years ago, and now it just kind of disappeared and then popped up more recently. So what is happening in France, and what should we be paying attention to and concerned about?
Well, thank you, Matt. This is kind of a miracle, I think, because the struggle in France has intensified since 2022, when Emmanuel Macron promised to follow the Belgian model. This is the first time we take Belgium as a model in France. And so then he set up a citizens conference which expressed support for a change of law at 75%. And then the ethics committee gave a positive opinion also about this. And then in the end, the government introduced a very permissive bill last spring in 2024. And the first reading began at the assembly, and it was almost adopted, but Emmanuel Macron decided to dissolve the National Assembly in June due to European elections. So the vote since then has been postponed multiple times, but it's coming back because yesterday the government announced that in May, starting 12 of May, there will be a discussion about legalizing assisted dying. But François Bayrou, our new prime minister, finally adopted our position, which is to separate the issue of developing palliative care and legalizing assisted dying. So there will be
those two things were in the same bill.
yeah. So it was very tricky because they put palliative care and assisted dying in the same bill, and also about language issues. The bill referred to aide à mourir, so age in dying. And Emmanuel Macron told us that it is not euthanasia nor assisted suicide, but it was both. But we're used to this kind of tricks with Macron. But so the palliative care and euthanasia and assisted suicide were in the same bill, but François Bayrou, our new prime minister, decided to split the two topics, but they will be discussed at the same time, and the vote will be on the same day. So this is still a bit complicated for us because there is a huge pressure, even among the government. We have a very bizarre coalition right now, and people still want to put these two texts in the same bill. But I think we will have to fight again on May. So we'll see what happens. But at the same time, we organize a coalition of 20 organizations representing 800,000 caregivers, which name is Collectif Soins de Vie. And we wrote our own ethical opinion stating that giving death is not caring. So we are organized, and we are still gaining more attention, more help from different circles. But I think the real debate will take place in 2 or 3 months.
Interesting. Yeah, in at least in American English, I don't know if it's the same in the UK, but we would use the term Odd Bedfellows Coalition. In fact, that's typically the case. I think that our friends from the UK and Canada would say the same. But in the US, you'll have people who are fighting against assisted suicide laws who come from as far left as you can imagine. It would like to, I don't know, like an anarchist, communists. We have, like, the socialist newspapers are often the best.
Same here.
While at the same time, you might have people who resonate with those who stormed our Capitol building on January 6th several years ago there, who are from the far right and who also oppose assisted suicide laws. And that's some of the strength of our side, is that we're not this uniform silo of people. You have people from every worldview and every political stripe opposing assisted suicide laws, because this is really much less a right, left, or political politically charged issue in that way. It's a human being issue. And I think that's probably why you're able to pull together all those various medical associations in France. And I'm just assuming that I know of a couple of progressive disability rights organizations, and I'm certain that some of the religious and pro-life and family groups would also be opposed. And that has been the bulwark, at least in the US, is we don't just get one bill where we have to fight federally, and it's kind of a high staking game for you all in countries where it's more federalized. But it's a state to state battle. So every single year we have something like over 20 states with proposed legislation. This year it's 19 states. We have 19 different bills, each one with its own little twist, 19 different legislatures to have to deal with all the personalities and the egos, but also the many wonderful advocates and allies coming from together. When they often are going to the same legislatures, fighting each other on other bills, they're willing to hold hands and oppose these dangerous public policies because they're bad for people. They erode human dignity. So I was glad that, Laurent, that you covered the question about what your prime minister did, because I think there was a way in which it's genius, right? Because they're putting the two things together made it so that people who really want to promote palliative care and do the right thing for people who are suffering felt like, oh, well, I can't say no to that. And it would be even harder to say no to assisted suicide when that's combined with it. But separating those two things, which are obviously different things, gives people the opportunity to at least look at each thing as it is, not.
Yeah, so this is a first victory, but still the bill which might be presented at the assembly is very violent. Maybe we can go into the details later, but it would be I think the most permissive law in the world, even
Wow.
worse than Canada.
Wow. Krista, I'd like to just hop back to you for a moment. So you explained track 2, which is basically euthanasia for people with disabilities based on disability, nothing to do with somebody dying or having a life-threatening illness. It's just simply subjectively you have a physical condition that you subjectively think is unbearable, or the treatment for which is unacceptable to you. And so now you can apply for and get euthanasia. Even to the extent that, I mean, like, as far as I can tell, it's like I've got a hangnail and I happen to have acute clinical depression, so I apply for and could get euthanasia in Canada. I mean, like, maybe that's an exaggeration, but could you tell us a little bit about the Charter Challenge and what you're attempting to do with it? What the goal is here?
Yeah, so in Canada, we have what's called the Charter of Rights and Freedoms. So that's why we're calling this a Charter Challenge. And it is a very powerful law in Canada, which is a good thing. And it has certain protections. Obviously, people with disabilities are one of the protected groups under the Charter in terms of discrimination. And so a coalition of disability rights organizations, along with a couple of individual plaintiffs with disabilities, are challenging. We've launched a court challenge at the Ontario Superior Court of Justice, challenging the law under Section 7 and Section 15 of the Charter of Rights and Freedoms in Canada. So that's essentially what is happening. So what we're asking for is a complete repeal of, at this point, this challenge is focused on track 2, MAID, assisted suicide.
Got it. And maybe you want to decline answering this question, because you should feel free to do so. But as you know, we at the Patients' Rights Action Fund see all assisted suicide and euthanasia law as inherently discriminatory against people with disabilities. And as you know, we too have filed a lawsuit against the state of California for having passed such a law. And it's based on the ADA. So the basic argument is if people go in and express a desire to harm or kill themselves in a medical setting, the standard of care is suicide prevention care, except in states where assisted suicide is legal. If you happen to have a life-threatening disability or you opt to forego care that's otherwise keeping you alive, all of those normal protections go out the window. And the only people who get suicide help are people with disabilities. They're a subset of people with disabilities. And so that's a protected class in the United States of America under the Americans with Disabilities Act. So you violated the ADA and equal protection under the Constitution. So would you see it possible that track one is susceptible to a similar lawsuit to that?
So it's tricky, only because, so first of all, I totally agree. I have, I don't disagree with you. And there's holes in our law. There's holes in track one as big as the ocean, in terms of, if people happen to get denied for track two, which is rare, but if they happen to get denied for track two, then they're just counseled to stop eating and drinking, and hence they will qualify under track one.
Right.
So, because they're essentially now dying. So it's a really slippery slope. And in the Supreme Court case that I mentioned, we were interveners in that case, and of course we're arguing for no form of assisted suicide at all to be allowed for the inherent discrimination against people with disabilities, because we knew it would get to this point for all of the reasons. What makes it trickier in Canada is that because we've already had a Supreme Court case, which is our highest court in the land, right, that has said that this that there has to be allowance for some form of assisted suicide in certain cases, which is not very clearly defined. I'm not saying it wouldn't be susceptible. I'm saying it just makes it more complicated, I guess, for us under track one.
Because you would not be dealing with a public policy. You would be dealing with case law that you would have to somehow get around. And that has precedent with it and everything else. Yeah, fair enough. It's just so blatantly obvious. I mean, we recently had a case here in the US where a woman in Oregon received a dementia diagnosis, extreme early stage, was not even experiencing symptoms, and decided to use voluntary stopping eating and drinking in order to qualify for lethal drugs, received them, and killed herself 8 days later. Perfectly physically healthy person. And no prosecutions, no looking into it, nothing. Obvious loopholes there. I wanted to get to a couple of the open questions. So one of the things that is difficult in working in these Odd Bedfellows Coalition is that we don't always agree on anything else. Almost anything else. What I've found is that when you get the group of people together, it is literally the only thing they agree on. And so Marianne Scobie is asking, how do panel members deal with the dissonance of campaigning alongside religious organizations? I think, everybody who's here is from a secular organization or an individual campaigning in that way, if you're campaigning. So we're often put in the position of sharing speaking platforms, etc., with religious organizations, and individuals have views and beliefs very contrary to our own. Furthermore, we're often criticized for doing so or dismissed as being religious ourselves. How do you all deal with that? I know how we do, and I could answer that, but I just want to throw that to the crowd and just kind of, because it's not as though people with a religious persuasion are bad or they're going to necessarily and always harm the conversation. It's just, and we never want to alienate our allies. So what are best practices with whether you're religious and you're thinking of the seculars or vice versa? I mean, how does one work together with people you disagree on basically everything else, but you agree on this? And I guess the subsequent question really is, how do you deal with the problem of public perception when you're campaigning or advocating alongside of people who disagree with you in that way?
I can have a go. I mean, Marianne, I know really well, so we probably had this. So hopefully, someone else will talk as well. But I think it's again a very useful way of marginalizing legitimate opposition. And opposition on religious grounds has a validity to it. Whatever brings you to oppose is relevant. But very simplistically, I think the debate has gone, if you're for it, you're very liberal and progressive. And it's about choice and autonomy. And if you're against it, you're religious and really just shut up, because religion has no involvement here in bodily autonomy issues. I know that varies depending on which country you're in, but that's certainly how it is in the UK, increasingly a secular country. What we have now, and what I don't know if it works, but it's all we can do, is we pretty much work in coalition with lots of different organizations, and we respect where each other's coming from. We try to, but we go, this is single issue. And we are not talking about abortion, and we are not talking about other issues that you were even trans issues, gender critical issues are coming in to this debate as well and connecting with it. We are not talking about those things. We unite on this one issue. But personally, because I'm on the telly sometimes, because I will do a lot of press on this, I will make it really clear that I'm from a disability rights secular perspective. And I think that's important in the same way it's important what language we're using around assisted suicide, and we just use that language and normalize it. I think it's powerful to go, I am not religious. That is not why. Because I think for a lot of people, it is quite a surprise as well that you can be opposed and not religious. And I think so it's an educative tool, but it's used to sideline us and marginalize us on the whole. But I think the way around it is acknowledge it, be really open and go, if you want to defeat these bills, then bring single issue, we work together, but be led by the secular organizations and the disability rights organizations. We're trying to do that in the UK and say, let Not Dead Yet lead on this, and you do your own thing, but be responsible.
Thank you, Liz. Any other thoughts?
I would just echo what Liz says. I mean, it's tricky business, because at least in Canada, very quickly the opposition to your position tries to marginalize you as the religious right, is what we would describe it as in Canada. And so, regardless of whether you're a religious organization or not a religious organization, the fact that you would be against something like this automatically sort of, they try to bucket you into that's the extreme religious right, folks kind of thing. And pit this with abortion and a whole bunch of other things. So I think, I would agree exactly with what Liz says. We have to work together on this particular issue because we both agree with this particular issue, but we are a disability rights organization. We come at this issue from a disability rights perspective. And it's not that we don't respect other people's perspectives and how they come at this issue. And what we have at our core is that we all agree on this particular thing. That does not make us as an organization part of a religious right in any way, shape, or form. Not there's anything wrong with that. that's just not who we are, and it's not how we come to the table.
Laurent, has the Palliative Care Association did the other side attempt to label you extrême droite?
From the beginning, we've been very careful to avoid religious or moral considerations. And surprisingly, the debate in France is not on religious questions. Even the French Bishop Conference argued that palliative care has to be developed, etc., has to be developed, but they were not on the sanctity of life or whatever. So for now, this is not a religious issue, and we have Catholic pro euthanasia and atheist against it. So we'll see, but we've been.
C'est parti. Yeah, that's interesting, and I think there's a way in which you've been able to head that off at the pass, so to speak. In the US, it is a constant struggle, because I think, in some sense, because the religious right, for lack of a better term, that's not a silo. There's a very big swath of people that, and that's interpreted in different ways. Also, there's a little bit more prominence of those who are right of center politically. And I think that in general, you probably, I don't know this because I don't have the stats in front of me or anything, but my impression is that there's more church, synagogue, and mosque going people in the US per capita than there are in some of the other Western countries. Now, that being said, the way that I've always discussed it with our allies, right, left, or indifferent, is our message has to be clear and be able to reach the most number of people. Sometimes you could have the best message possible, but you're the wrong messenger. The messenger matters. And when we deliver the message with the right messenger, then the message can get across. The whole point is to reach the most number of people with the message, and love it or hate it. And everybody can say this of themselves on some level. You too are affected by the messenger, even if the message is good. And if the messenger can be the sort of person, we put forward the messengers that are the sort of people that the most number of people are willing to listen to, then we have our best chance at penetrating a kind of first blush reaction that assisted suicide laws are good and helpful, and they alleviate pain and they give people more autonomy, which is all a load, and it obviously is problematic and not true. But we need to be able to penetrate that first blush reaction. And if you have you come out of the gate saying I'm X, Y, and Z, then as a messenger, you've already limited yourself through the audience who's willing to listen to you. So from that perspective, let's all, across the world from our side, be doing what we can do to provide that message that's tried and true, that everyone can receive, and anyone who's going to be the best possible messengers. I mean, like, we've done a bunch of research and polling and stuff like this on who the best messengers are. At least our research showed this is only looking at American perceptions. Best messengers are people who have outlived 6-month or less prognoses, people with disabilities, caregivers, and that includes doctors, nurses, CNAs, but also family members who care for people and their family who have life-threatening illnesses. And there you go. I mean, so if those people are the ones that the most number of people are going to receive the message well from, then why wouldn't we, as a coalition, provide them the platform and the opportunity to speak to these issues? I want to kind of ask more general questions for everybody. I know that we're running low on time. So I just want to take a quick look at the Q&A. Okay, so this is from Kim Laub, and I think maybe Krista, you'd be best poised to answer this. Is there a report or a statistical analysis in Canada that shows a rise in suicide in general now that they have embraced so fully physician-assisted suicide and euthanasia? This is what the legislators in the state of Iowa ask me for the most when fighting against this. Is there truth in this, and is it recorded anywhere?
So the short answer to that is I don't know if there's been a rise in suicide in general. What I know is we do have the data on assisted suicide, like under the law, quote unquote. And it's growing rapidly, including under track 2. We're losing more than a person a day with a disability who's not otherwise dying under track 2, and that number is going up. We are a year behind in what the data is that we have in terms of when they release it. So we've got ourselves dubbed as the most permissive regime in the world, with growing numbers of people accessing both track 1 and track 2. So that's the data we have on what's happening under the law. I'm not sure, generally speaking, if there's a report on that or not. So can't be too helpful on that. Sorry.
I will say that there are a couple of US-based studies that do show a rise in non-assisted suicides in the states that have legalized assisted suicide over time. And I believe that the adjusted increase was something like 4%, but I would have to go back and look at that data again. I'd like to.
Can I just say to that, Matt?
Oh yeah, please go ahead, Liz.
From my understanding, because it's been a huge debate, so it's very alive at the moment, ironically, in the committee over here, is that it, maybe more importantly, it doesn't reduce. So I think there are issues about it raising, and that's complicated. It depends on the jurisdiction, but it does not reduce. So we're often told if we legalize it, fewer terminally ill people, fewer non-terminally ill people will resort to suicide. They seem unlinked. I mean, and there definitely is not a reduction. And I think that almost across the board has been shown.
Thank you, Liz. Yeah, that makes sense. To look at it from that perspective is a slightly different answer to the question. So I just want to ask a general question for everybody, but maybe Reid, you could take a crack at this first. Is just that with all of your research for the film and traveling around to these various countries and jurisdictions that had legalized, and then I mean, from your perspective, what are the biggest misconceptions about assisted suicide laws, both here in the U.S. and then outside in those other places that you had the opportunity to go?
Yeah, I still think it's a little rudimentary and maybe a little peripheral to the letter of the law. It's this concept of ableism. People don't realize what ableism is and how pervasive it is. So when people hear that disabled people will be allowed to end their lives, they're picturing disabled people who have homes, who are in the community, who are active participants in society, who are employed, who just are so much pain that they want to die. In reality, disabled people are drastically and disproportionately represented in the impoverished population. There are extreme health care costs um, that are involved, I would say, with most disabilities, and as we see around the world, um, citizens embracing more conservative politics. We are seeing social safety nets and health care being stripped. So I think the biggest uh thing that people need to realize is that uh that society makes it hard, makes it really hard to live with a disability, and that is where most people are coming from when they apply specifically to track to mid.
Interesting. Thank you, Reid. Any other thoughts on misconceptions across the countries considering this or have legalized?
I think there's a huge misconception that it's all about pain. And I think that to get it over the line, jurisdiction wise, with different systems, it's about terminally ill people at the end of their life, and it's about pain. And that's what we saw in terms of it getting through Parliament increasingly in the UK. And then now it's being debated, we're hearing, but it's about autonomy and dignity. And they're using those words. It doesn't matter if you're in pain, because let's put an amendment that means the person has to have a terminal illness and be in pain and blah, blah, blah. No, that would be restrictive. Let's not restrict. So I think the myth is about that's what it's about. And if it were, then we would have these laws for people within about 2 weeks of the end of their life. You know, absolutely none of us here, I don't think, are claiming that all deaths are brilliant and that it can't be, it's not a tricky situation here, and people, we understand, are not getting the right support at the end of their life. But to change the system and allow doctors to either directly give the medication in a prescription or actually an injection is such a huge and risky and dangerous and societal changing move that the needs of that group of people have to be balanced with the needs of everybody else. And I think sometimes we get labeled as it's disability versus terminal illness. It's the rights of one, and actually we're all the same. Firstly, there's such a fine line between the two. Anyway, but actually I'm concerned about those people who are terminally ill who do not want assisted suicide, but if it were legal, see it as something on the buffet of treatment options, whatever that Krista said, the medically effective treatment options. You know, once it becomes available, then you start to think, well, maybe it's the thing I should do. Everyone's doing it, or it will, you know, protect me from being a burden to others, etc. Save my
Yeah, I
family.
mean, and that's where this begins to look a whole lot more like eugenics than it does choice, because so many people don't have the range of options, and neither are they empowered to make them. And so that's where I think we need to end the day. We're at the top of the hour. I just wanted to thank our panelists. You're all brilliant and wonderful. We're grateful for all of your advocacy on this, and for the amazing resources and the 2 documentary films that were made. We use them regularly. I can circulate Liz's Better Off Dead, which she said is on YouTube. We have that link. And I put the link into the chat for anyone who's interested in seeing Reid's documentary Life After. Krista, Laurent, Reid, Liz, thank you so much for joining us. And thank you everyone of the attendees for joining us today. If you have any questions that didn't get answered, we'll do our best to answer those and circulate. I hope everyone has a great rest of your day and a fine weekend. Take care.
Thanks all.